Welcome back to CBS Mornings. It is 7:30. So you probably know someone who says they've got that clicking, that popping, or the pain in their jaws, what are frequently called TMJ problems. As many as 33 million Americans struggle with the problems associated with that jaw joint. And these disorders are, listen to this, up to 9 times as common in women than men. Why is that? There are many treatments, but here's a question: are any of them effective? Our senior consumer investigative correspondent, Werner, we're happy to say, has joined us in the studio. You've been looking into this with our partners at KFF Health. Anna, welcome. Good to have you.
Thank you, Gayle. And it's true, from 5 to 10% of Americans have pain from TMJ problems, and it can be debilitating. People seeking help are offered everything from splints to surgery. But we've found common treatments are backed by little to no science, and some patients are harmed. A warning: viewers may find some of these images disturbing.
Dealing with chronic pain is so draining.
Head out on social media and you'll find many people complaining about their TMJ issues. Clicking, popping, and pain, they say, comes from their jaws.
I feel like I couldn't recognize myself in the mirror.
Lisa Schmidt can relate. She was 28 and a mother of 2 young children when severe headaches sent her to a doctor.
I remember the guy saying, it's TMJ and you just need to go see this orthodontist and he can help you.
TMJ meaning temporomandibular joint, or the jaw joint. The orthodontist gave her a removable splint similar to this one to ease the pain. But she says after 3 days, her jaw locked up.
And it was an intense pain.
Her next stop, an oral surgeon, who she says told her that too much stress from having kids had caused misalignment of her bite. He performed a jaw surgery, but afterwards,
opening my mouth would make noises, and it was like crunching, like sandpaper. And when I saw the orthodontist, he said, "You're bone on bone, your bone is grinding down."
At the time, she worked as a contractor for NASA.
For experiments that would happen in space, we would teach the astronauts how to do those.
So you were training the astronauts?
Yes.
But she says the intolerable pain forced her to quit the job she loved.
There were days where I couldn't get out of bed. It was really hard.
Then a surgeon told her she needed her jaw joints replaced entirely, with metal parts screwed into her skull. That was bad enough, but she says the worst pain came 12 years later, when doctors had to remove those metal joints because of an apparent nickel allergy. They then implanted long screws in her jaw and told her to turn the screws each day in a procedure designed to try to lengthen her jawbone.
You had to take a screwdriver and you turn it.
So you're tightening a screw in your own neck?
Yes.
And what was this like?
It was torture. It was awful. And I would just sit there with tears coming down my face because it was so painful. I can't even tell you how horrible it was.
CBS News and KFF Health News interviewed 10 patients who told stories of failed TMJ treatments.
Every 6 months, I was doing a surgery.
I'm in constant, severe, unrelenting pain 24 hours a day.
You can't shut this off.
What patients often aren't aware of, health authorities warn some TMJ treatments don't work and may make the problem worse. A 2020 study from the National Academies of Science, Engineering, and Medicine found many dental treatments have no supporting evidence and are overly aggressive, often leaving patients harmed. Stanford professor Dr. Sean Mackey co-chaired that study.
We learned it's a quagmire. It really is.
A quagmire?
A quagmire. And some of those procedures, some of those surgeries clearly are not helping people.
He and other experts also say for too long, TMJ patients weren't taken seriously.
And unfortunately, there is a greater proportion of these people who are women. And a lot of these women are referred to as histrionic housewives, or they're told it's all in their head.
They had decided that this is a women's issue.
New York City's Jenny Feldman says she's been told that since her problems began at age 15.
We're spoken down to by the majority of the doctors who treat it, which are predominantly men.
She's endured some 24 TMJ surgeries. Her latest jaw joint replacement came last year.
They had to cut all this bone out because it was rotted away. So now the pain is through the roof, and I'm just done. I'm just done. I'm just done. I don't want to live like this anymore. I really don't want to live like this anymore.
Health officials say there's a desperate need for solutions.
I would say that the treatments overall have not been effective.
Dr. Rena D'Souza heads the National Institute of Dental and Craniofacial Research.
We want to move the needle and make the lives of patients suffering from TMJ bearable.
But it comes too late for patients like Lisa Schmidt. She had a second joint replacement in 2017 and is just hoping it's her last.
I don't think I could go through that again. You know?
Well, the federal research budget for TMJ conditions recently doubled, but remains small at $34 million. The National Academies is calling for better education about TMJ disorders across medicine and dentistry, more research funding from the NIH, but of course, it's allocated by Congress.
Wow, that was shocking.
It does sound torturous. It sounds barbaric in these times. That she had to go through this.
Yeah, the experts will tell you there's sort of a profound lack of understanding about what causes these problems, the variety of different problems you can have, and whether that's actually the jaw joint or whether that's something to do with the muscles or the cartilage. This is a complex joint, and yet the research for this compared to like your knee, it's nothing compared to their
Am I
knowledge.
exaggerating when I say some of these procedures seemed experimental?
Well, I think if you talk to some of the patients that we did, they would agree with you. Some of them do definitely feel like they were experimented on. And the problem is they're lacking a lot of these treatments. The NASM report says it flat out. They're lacking evidence. Evidence-based medicine. There isn't a lot of evidence on some of these treatments.
Nobody wants to be a guinea pig. I'm curious about, do they know why more women than men, and is there anything to get more funding?
They don't know why more women than men, and one of the things they say is that because it's been a women's problem, it's been lacking the research and the funding.
We've heard that before. Yeah. Anna, thank you very much for shedding some light on this. Appreciate it.